Good morning. Welcome back to Open Med School. We have studied the absorption of lipids and the method of digestion also. Today we will be discussing a few clinical cases. One of the very important disorder of lipid absorption is disorders of digestion or disorders of absorption. Both can lead on to malabsorption of fat. Even though technically malabsorption means disorder of absorption alone, but clinically disorders of digestion and absorption both comes under the malabsorption syndromes. What will be the effect of malabsorption? This will lead on to extreme emaciation. That is, the patient will be only skin and bones, fat will be lost. And characteristic abnormality is steatorrhea. So what is steatorrhea? Steatorrhea is the passage of voluminous, foul-smelling, oily feces, and this is usually very difficult to flush also because fat is not soluble in water, they will float in the toilet. So the disorders of malabsorption can be either to disorder of digestion. So how can you get disorder of digestion? One, the enzymes are defective. Classical example is the pancreatitis, where the exocrine pancreas is dysfunctional. That leads on to disorder of digestion, that is lipase is not acting. Second is the defect in bile. We have studied that the bile is required for the emulsification, and emulsification is essential for the pancreatic lipase to act. So these are the two important conditions we should remember. Then coming to disorders of absorption. So how can do this? Mainly due to the mucosal disorders. When the jejunal mucosa, as we know, the majority of the absorption of the lipids occurs in the proximal jejunum. So jejunal mucosa either structurally abnormal or some disorders are there or it is resected. That is, the total amount of jejunal mucosa is not there. This can lead on to disorders of absorption. So let us see what are the common mucosal disorders. So the defective absorption due to mucosal disorder, most important thing you should remember is one is celiac disease. Second is tropical sprue. Third is inflammatory bowel disease. The classical one is the Crohn's disease. So this leads on to disorders of or surgical removal of intestine that occurs in certain diseases. And the obstruction to bile. This will lead on to disorder of digestion followed by absorption defect. As we have already mentioned, same thing is for the pancreatitis or disorders of the pancreas leading on to exocrine pancreatic deficiency. Two more important conditions you should remember. One is the urine becomes milky. So this is the urine of a patient and these are just like milky. So it's because of the excess amount of triglycerides or fat in the urine. This occurs when there is a communication between the lymphatics that drain the intestine, that is lactase, are joining together to form the thoracic duct. In some way there is some communication. This can occur in certain diseases of the lymphatics. Like filariasis can occur or some malignancy blocking the lymphatics can occur. So this is an important condition, remember. So chyluria. So this is called chyluria. So urine contains chyle, this milky. Another condition that can occur is that pleural cavity may be filled with fluid. When the pleural cavity contains fluid, it is called pleural effusion. It can be milky, it is called chylothorax. So this is the fluid taken from the pleural cavity and is milky. This is called chylothorax. So just like chyluria, it is called chylothorax. There are certain other conditions which imitate a chylothorax. This is called a pseudo, and that will be studied in later sessions. Hope these are the things you should remember regarding the clinical parts of the malabsorption. One is the extreme emaciation leading on to steatorrhea. Second is a blockage to the lymphatic drainage leading on to the chylothorax and chyluria. Hope this was useful to you. Stay tuned for further videos. Thank you.